basically with a background. It is either the Grand Canyon or it's Bryce Canyon, one of those two. Is that correct?
It is the Grand Canyon. Good eye.
And it's the north view, isn't it? Or is the
It's
south?
from the south.
It's from the south.
Yep.
Anyway, very good. So we have a connection already. Very good. Well, I would like to welcome you all here to this thesis defense, in which Miss Melissa Rethlefsen will going to present her thesis, improve the reproducibility and reporting quality of search strategies in biomedical systematic reviews. And I would like to give you the opportunity to present your work to our here online system and the members in about 15 minutes. And we are looking forward to your presentation. And I'd like to give you officially the word. Dr. Rethlefsen, it's your time now.
Thank you. All right. Well, thank you everyone so much for being here today. I'm really looking forward to talking with you about this topic. All right. Patients and healthcare professionals both want to have the best possible decisions made about healthcare. Making good decisions relies upon a combination of scientific evidence, experience, and the patient's values. But what makes this kind of tricky is the scientific evidence. Every year, more than 1 million new scientific papers are published in biomedicine. So keeping track of all of the papers on a certain topic and deciding which ones are the best or the most appropriate is a nearly impossible task. Review articles, or articles that look at all of those papers and draw conclusions from them, are designed to help with this challenge. They do the hard work for readers. Review articles have often been written by one or more experts on a topic. Those experts use their knowledge of a topic and their knowledge of the latest research to create those articles. But review articles that are written by experts can be highly biased towards the opinions of that particular expert. So that means that a review article written by a different expert could give different advice. This slide's definition of systematic reviews by the Cochrane collaboration makes it clear how different systematic reviews are from expert reviews. They look for evidence, but that evidence must meet pre-specified criteria. That is to say, the evidence is not selected based on whether or not the authors agree with the results. That evidence must answer a specific research question. But most importantly, systematic reviews minimize bias in the process of collating evidence by using explicit, systematic methods that are spelled out in advance of collecting that evidence. Finding the evidence, or the search, is a critical component of the explicit systematic methodology mentioned in that definition. The search is really the whole process of finding information, and a search strategy is what you can put into a database to find evidence there. There are two primary ways that the search could add bias to a systematic review. The first is not having a wide enough selection of information sources. That means maybe you're just searching one database like Medline. Second is not having a sensitive search strategy within those information sources. Each of these can limit what evidence you find to a smaller portion of the evidence. Even when the search method is high quality and designed to reduce bias, clear reporting is really required to help readers understand how the study was done. Reporting is the way research is documented and communicated in the scientific literature. And reporting guidelines are tools that help authors write up their studies clearly, and PRISMA is the most commonly used reporting guideline for systematic reviews. One of the hallmarks of a systematic review search is that the search strategies are reproducible. Without clear and transparent reporting of search strategies, it is impossible to reproduce a search. That brings us to librarians and information specialists who bring unique expertise to systematic review searching process. Most are experts in searching for information. Expert searching requires extensive practice and deep understanding of how each database and information source is structured and can be searched. Because of their expertise, their involvement in the systematic review search should help to improve search quality, reporting, and the reproducibility of searches. Throughout the remainder of this talk, I'm going to refer to them jointly as librarians. In this thesis, we aim to explore ways to improve the methodological and reporting quality of systematic review searches and to understand the role that librarians can and should play. But really, the first stage towards improving methodological quality and reporting quality was to understand the scope of the problem. In Chapter 2, we looked at 630 systematic reviews published in 5 general and internal medicine journals from 2008 to 2012. We used the standards from the United States Institute of Medicine to study the methodological quality of the search. Those standards include 15 different components that relate to the search and should be there in order for the search to be of high methodological quality. However, we found that only 6 of the 15 standards were actually followed by 50% or more of the systematic reviews in our sample. From that group of 630 articles, we were able to assess at least one search strategy for 270 of the articles. We used a scored version of a tool called PRESS, or Peer Review of Electronic Search Strategies, to do so. The scores could range from 7, which was low quality, to 45, high quality. And this violin plot shows the spread of the scores, highlighting the wide range of those scores as well as that the average score was about 30. But lest you think that the problem has resolved itself in the past 12 years, in Chapter 7, we looked at 166 systematic reviews in general and internal medicine journals from 2023. We assessed these tools using a tool called ROBUS, or Risk of Bias in Systematic Reviews. ROBUS looks at similar aspects of the search and search strategies as the Institute of Medicine standards and PRESS that were used earlier, but ROBUS was specifically designed as an assessment tool. The 4 ROBUS signaling questions on searches can result in an overall rating of low, high, or unclear risk of bias. What we found is that 63% of the articles in our sample had searches that were high risk of bias. So we know that methodological quality could stand some improvement, but how about reporting quality? Well, in Chapter 3, we looked at 272 systematic reviews in cardiology, pediatrics, and surgery journals from 2012. We found that no systematic reviews reported all search elements for every search strategy. This chart shows in light blue when a search element was reported for at least one database search strategy, and in dark blue when it was reported for all database search strategies. You can see the clear dichotomy. More recently, in Chapter 5, we took a sample of 100 systematic reviews that were indexed in Medline in November of 2021. We looked at whether or not they reported 6 search elements taken from the reporting guideline, PRISMA-S. All 6 of those would be necessary to reproduce a search strategy. But the same results are apparent here. Articles may have 1 or more search strategies reported well, but not all of them. In fact, only 2% of the articles reported all 6 items for all databases. In Chapter 7, we used 4 of the same PRISMA-S criteria to look at 166 articles in general and internal medicine journals. We found again that though some of the articles did transparently report these individual items for all databases, only 7 reported all 4 of them. Reporting quality leads directly to the ability to reproduce a search. How we defined reproducibility evolved a little bit throughout this research. In Chapter 2, a reproducible search was considered the presence of one complete search strategy, including the Boolean logic behind the search. And with that definition, 43% of articles met our criteria. In Chapter 3, however, we looked for the presence of that same complete search strategy, but also at 4 other elements required for a reproducible search, such as the database name. The percentage of papers meeting that criteria halved. But later, I realized that even that level of detail was truly not enough to judge whether a search was reproducible. We really needed to be able to try to reproduce it, to be able to tell. When we looked at the elements required for a reproducible search and whether we could get the same results by using the same database with the same search strategy, we actually found that only 1% of the papers had a reproducible search for all databases. So how can we actually improve reporting and then hopefully reproducibility? Well, one of the major outcomes of this work was the creation of the PRISMA-S reporting guideline. PRISMA-S is an extension to the main PRISMA reporting guideline, and it details how searchers should report 16 different items related to the search in order to maximize transparency, clarity, and hopefully down the line, reproducibility. It was really the first time that there was detailed guidance for reporting many of the different components of searches, and it's been adopted for use internationally. Looking at the impact of librarians on systematic review search methodological quality and reporting quality, we found that when librarians are involved, methodological quality is improved. Librarians use a wider range of sources, they create higher quality, more sensitive search strategies, and they generally have searches with lower risk of bias. Because their searches are so complex, however, we did find varying results on reporting quality and reproducibility. Sometimes there was a clear benefit of having a librarian involved, and other times, not so much. But when librarians are co-authors on a systematic review, they can presumably have better control over how the search and search strategies are reported and how they're done, and this shows in our results. For example, this figure from Chapter 2 shows the difference in press scores when librarians are not involved but not co-authors, and co-authors, which is on the right. There is a clear increase in methodological quality of the search strategies when they're co-authors, and less variability. In addition, librarian co-authors impact reporting quality. Librarian co-authorship was the factor most strongly correlated with reporting quality in Chapter 7. In Chapters 6 and 7, we looked at a third way to try to improve methodological quality and reporting quality, this time at the peer review stage. We had hoped that by involving librarians as peer reviewers, similar to statistical reviewers, that they could provide specialized expertise that could help to ensure both methodological and reporting quality. In the randomized control trial that we conducted, however, we did not find that to be the case. But we did find that papers peer-reviewed by librarians were rejected more, potentially because they had identified unfixable, or at least not easily fixable, errors in the methods. This work has already had impact, primarily from the creation of PRISMA-S. PRISMA-S was incorporated into many other reporting guidelines that came later, including PRISMA 2020. The librarian peer review randomized control trial is actually only the third randomized control trial ever published on methodological peer reviewers' impact on reporting quality, the other two being on statisticians. Though the study was negative, it did contribute to the development and the use of the librarian peer reviewer database, and it led to greater use of largely untapped set of experts in peer review. It also identified major gaps in search reproducibility, which can help us to develop new interventions. But most importantly to me, however, is that this work has promoted the role of librarians and information specialists in systematic reviews. But ultimately, I hope that long-term, this work increases the quality and the reproducibility of systematic reviews, which can help support patients and healthcare professionals to make better decisions. With that, I thank you for your attention, and I welcome any questions that you may have.
Thank you very much, Ms. Candidate, for your good presentation. It was a good strategy, well defined and in time. And yes, you will get questions because we have 5 members in the Corona who are going to address questions to you. And since this is an online presentation, an online Corona event, I'm going to introduce also for the members who are your viewers who are online and look also to your thesis events. I'm going to introduce briefly your promotion team. And there are 3 members in your promotion team, which you can follow later, and I will call them first. We have Professor Schroeter. She is from the British Medical Journal in London based. Then we have Professor Bouter. He's Emeritus Professor of Methodology and Integrity of the Free University or the Vrije Universiteit in Amsterdam, the Netherlands. And then finally, as your first promoter, we have Professor Segers, who is Professor of Complex Genetic Epidemiology and who is also available today, of course. And the 3 of them have guided you over the last years to reach to this point that you're going to defend your thesis today and you get questions. And regarding the numbers of the members in the corona, for the people who are online, there will be 5 members in your corona who are going to address questions. And I'm going to start with Professor Kleine. Professor Kleine was also the chair of your assessment committee, and he is the Emeritus Professor of Systematic Reviews in Healthcare, and I would like to give him the opportunity to discuss with you. Professor Kleine.
Thank you very much, Rector. Dear Ms. Rethlefsen, thank you very much. I think you have produced a wonderful PhD thesis with a whole range of chapters which express different research methods, which show that you have acquired the skills of doing all these different types of research. And I would also like to congratulate your co-authors and your supervisors with this result. But I would like to ask you a number of questions. And the first question will be a short one, and that is whether a search, in your opinion, can actually ever be reproducible. Assuming the answer may be a no or only partly yes, then I would like to ask you whether a search strategy can ever be reproducible. And depending on your answer, I'd like to discuss that further. Thank you.
Highly esteemed opponent, thank you so much for your kind words and also for this great question. It's one that I think about a lot, as you might imagine, and I do think that there are a lot of aspects of the entire systematic review search that probably cannot be reproduced. And as I was preparing for today, one of the things that I was reflecting on was that one of my colleagues that I worked with many years ago told me that, well, you know, it's not even an issue to try and reproduce searches because they can never be reproduced because people look in their own files to find articles. And so you can never have access to those personal files. So I do think that there are some challenges to reproducing the search as a whole. And certainly I think that the research that I have done has shown that it is not easy. But that's not to say that it's not possible, but it's very much not easy. And I think the same is true with search strategies as well. When we were reproducing search strategies, we actually found a number of them that were reproducible and, you know, clearly had been accurately reported. We were able to easily try to reproduce them. So I think that it's a lot more possible. But where we come into some difficulties with reporting the search strategies is really in knowing what databases people are searching and what some of the default methods that people are using to search. Because some of those things, it's not clear to people, especially to non-experts, but even to experts sometimes, what it is that they're actually searching. And to know that, and then you need to be able to try and have that information in order to reproduce something. And sometimes it's just extremely complicated to try and track down that information.
Okay, thank you. Thank you very much. Do you think reproducibility per se should actually be the major goal? I would imagine that in an example that I experienced very early on in my career, where somebody criticized my searches and wanted to reproduce them and redo them. Actually, his goal was not to reproduce the search. His goal was to find out whether we actually missed any studies. So should we maybe change our focus a little bit from reproducibility per se to maybe unbiased reviews and to avoid bias?
I think that's a great question as well. And I think that we need both. And the reason why is actually the impetus behind why I did this study in chapter 5. And that was that I was reading an article that was in The Lancet. I was going to reproduce their search to try and update it. And I realized when I was trying to reproduce it that they did not actually use that study or that search. That search was clearly not what they actually had done. And the search that they had published was lovely, and it was really excellent and something that every librarian would be proud of. But it had clearly found too many results for the research team, so they clearly had scrapped it and used a different search. And so without that kind of information and the ability to even try to reproduce a search, you're not actually going to know what they did. And knowing what they did is a huge component of how we can assess the quality of a systematic review and how we can trust the findings from that systematic review.
I think that is a very good conclusion. Thank you very much. I move on to my second question, and that is about the randomized trial and the use of ROBIS domain 2 in assessing the impact of librarians in the peer review phase of a systematic review that has been done and has been offered for publication. And you find no impact on ROBIS domain 2. I was not actually expecting any impact. I would have thought that if you want to measure the impact of a librarian on ROBIS domain 2 on the and basically on the quality of the search, maybe you need to look at it at a different stage. What are your thoughts about that?
I think that that's actually the question that I get most. Why would you look at the quality of the search at the stage where it's submitted for peer review? And why not do it at the protocol stage? Why not do it at the development stage? And I think that's a valid question. But the fact is that not everyone is publishing their protocols. Not everyone has access to an information specialist when they're actually creating their search strategies. And so having a librarian potentially as a methodological peer reviewer can serve as an extra stop potentially on publishing things that are just not done well. And so though we didn't affect the ROBIS outcomes, we did impact the number of articles that were rejected. And though I know that rejection is not ideal because of course they can submit to another journal, the fact is that at least it helped stop those articles from being published in that particular journal, which may be used as a model for people who are trying to publish in that journal in the future. So to me, that was really more the indication of how we were impacting the quality.
Oh, thank you very much. That makes sense to me as well. So my third question is, what are actually the necessary skills and experience of an information specialist to adequately support a systematic review? Because it's very nice to conclude in your thesis that you need to involve them in every systematic review, ideally. But in my experience, a lot of librarians do actually not have the skills available to give that support. So I see a big discrepancy between the workforce that is out there and the workforce that's needed. So, I would be interested to get your feeling about what skills and expertise does such a librarian need in order to do a good job?
I think there are several different skills that a librarian or information specialist would need. One of them is familiarity with the systematic review process. So really, what are those standards for conducting a good systematic review? They really need to have that understanding that this is a pre-specified kind of search, that you are looking at these eligibility criteria, that you need to make sure that your search is having a lot of different kinds of information sources to find published and unpublished research, that you're going to need a sensitive search, and that is going to be needed to document it well. So those just having that knowledge that that is a part, I think, of the process of a systematic review is really important. But then you get into some more of the technical expertise, and a lot of that has to do with a lot of practice using databases, like a lot of practice, and really understanding and testing them out and knowing how each of them work, because every single database operates slightly differently, some of them completely differently, and you have to have that ongoing practice, that ongoing professional development to know how changes are going to impact how you're searching and to be able to accommodate those easily. So I think that's part of it. And I also think that part of it is knowing how to actually document your search. So for example, being trained in using Prisma S or Cochrane's Messier tool to be able to fully document and make sure that your search is as reproducible as possible. And I would agree with you. Not all librarians have all of these skills, and I think a lot of them are trying to learn. The Medical Library Association has a systematic review specialization that they have created to try and teach some of these skills. But a lot of places where librarians are getting their education are not teaching this. And that's really in contrast to a lot of programs like epidemiology.
Yeah, Ms. Candidate, I just have to interrupt due to time because
Yes.
we have former opponents and I would like to give them all the opportunity. So we're going swiftly to Professor Boutron. She's professor of epidemiology at the University of Paris-Cité in France. And of course, thank you that you joined today, and I would like to give you the word, Professor Boutron. You have to unmute.
Thank you very much. Well, I would first like to congratulate the candidate for the quality of the thesis that we received and the impressive amount of work of a very high quality that she did. I would also like to thank her for the quality of the presentation, which I found very complete and very nicely said. Nevertheless, I have some questions. Perhaps my first question would be related to the work that she did on evaluating the role of librarian as co-authors on the methodological quality of the reviews. And I would like to have her advice on how she sees that confounding factors might have influenced the results and could perhaps be explained by other factors than just the co-authors as a librarian.
Highly esteemed opponent, thank you so much for your kind words. I really appreciate that. And I think that you are absolutely right to identify that there might have been potential confounding looking at librarians as co-authors. But it is actually a theme that has shown up not only in my research, but in others who have followed my research and tried to find it in other disciplines as well. So I think that there's a lot of consistency in the research on this topic at this point. And also, it was the thing that was most highly correlated with reporting quality in particular in our librarian peer review randomized control trial. So again, kind of consistency of results. I do think that there is potential for some confounding, which is why in that study we actually had done a multivariate analysis, and we had found still though that that was the item that actually stuck out the most as potentially being associated with reporting quality. There are other potential confounders that we've looked at. So we've looked at use of a reporting guideline, use of a conduct guideline, mentioning or acknowledging a librarian. We've looked at using press to do a peer review of the search strategy. We've looked at a number of different other potential confounders, and we haven't found any that have been strongly associated with either being a co-author or with also with quality. So I feel that this is a pretty strong trend and theme that has been identified, first in my paper that was in 2015, but then in subsequent research as well.
Thank you very much. My second question is more related to the work you did on the extending the Prisma guidelines for reporting search strategy. So you used, the clear method that is a recommended method to do. So I've got no criticize on that, but I would like you to step back and perhaps give me your feedback on whether you think that the choice of the participants in such Delphi process and also the Delphi process by itself, isn't it a risk that in the end, almost all items are kept and that we arrive with a huge checklist with all details, while the reporting guidelines aim to be the minimum amount of information that needs to be reported?
Thank you for that question as well. That took place quite some time ago, but what we really did was try to find a really representative sample of who we might involve in the Delphi survey. So we, of course, invited librarians and information specialists, but we also invited journal editors. We invited researchers who have done a lot of systematic reviews as well, to really try and get a balanced kind of feedback on this. Of course, the majority of our respondents were librarians and information specialists because they have the most at stake in this particular topic. So they were the most interested in participating. But we did actually have representatives from many different groups that touch on systematic reviews. I would also say that, yes, we did find that, of course, a lot of the different items wanted to be retained. We were able to really take all of the items that we had uncovered through the Delphi survey and condense them down originally into about 20 different items, but then after review and open peer review by other people who were not involved in the original Delphi survey, we ended up getting to those 16 items. And I've actually gotten quite a lot of critique on removing at least one of the items there, which was to state the qualifications of the searcher. And that is the one that seems to resonate with librarians, that we removed it. But we did because it doesn't make sense to have that when we don't ask for the qualifications of the person who did the statistics. So there's reasons behind how we try and made those as simple as possible. And subsequent, we've actually had calls to redo parts of Prisma S, particularly around citation searching. So Tarsus was released last year, and that really focuses on the reporting of citation searching. And there was a lot of calls from that to be able to, further expand on how we are reporting certain of these items. But we really did want to make this a minimum set of reporting standards. And whenever I talk about it, I try to state, this is the minimum. You can always go beyond it. There is no reason to only report these if you want to report more. And I think people find some reassurance from that, but I do think librarians and information specialists as a profession like to have a lot of detail in front of them.
Thank you so much. And my last question is more perspective. As you know, research is changing very quickly, and currently we have a lot of very well-performant AI tool starting to be used and assessed with quite good results. And I would like to know how you think it will change the way we do search strategy. I mean, should we just take all the database and increase the sensitivity and the specificity? And how do you see it in the future?
This is another question that I've thought a lot about, and I really appreciate you posing it, because it is certainly causing something of an existential crisis in our profession. But I think that we're a long way off from AI tools being able to achieve the same kind of quality that we can. But that being said, is it a dream that we would have these tools and we would need to have fewer librarians in the process because we could actually do it really well through AI tools? Yes. But I think the limitations currently are, first of all, that AI tools only have access to what's publicly available, theoretically anyway. And so a lot of journal articles, a lot of databases that are specialized databases, those are going to be behind paywalls, and AI tools may have access to a few of them, especially if they're an AI tool developed by a publisher, but they probably aren't going to have access to all of them. So we still have the potential currently of not really having a broad enough set of information sources. Secondly, it's not clear yet.
Sorry, I have to interrupt.
Sure.
You can give a brief answer, but if you do it a very long one, we go to the next speaker.
Absolutely.
Aiko, we continue to the next speaker then, perfectly. Then we continue to Dr. Bramer. He is involved as medical library at the Erasmus Medical Center in Rotterdam. And I'd like to thank him that he joins us today, and I would like to give him the word.
Thank you, Mr. Prorector. Dear Ms. Candidate, thank you a lot for inviting me on your committee. I've read your PhD thesis with much joy. I'd like to congratulate you on your wonderful thesis and also your team of promotion. You've become a leading authority, I believe, on search systematically, peer review searching and reporting. And I'm really looking forward to some future cooperation. I hope we will meet each other again in a not too distant future. I do have a few questions for you. I was partially a bit disappointed when reading the article, the thesis, when I hoped that this would be solving the problem of there being too many low quality systematic reviews being published. And on the other hand, I thought is part of that is the goal, I believe, of your investment in peer review, to stop low quality peer systematic reviews from being published. But are we there if we stop them? Should the goal not be to increase the quality of the systematic reviews? And do you have ideas on how we could increase the quality of systematic reviews being published?
Well, thank you, highly. Thank you, esteemed opponent. I really appreciate the question, and I really appreciate your kind words as well. And I think that you're exactly right. There is a proliferation of low quality systematic reviews, and really the stopgap that we were trying to introduce as librarian methodological peer review was to try and help with that issue. But as you say, that's just a measure that can stop things at the end, but it's not going to make sure that what's being submitted to journals is high quality. And so I really do think that involving librarians more in the process is the way to go in order to try to improve quality at this point. And obviously for an entire systematic review, you need a team that is skilled in all sorts of things and not just the search. So, you really do need to have that multidisciplinary group in order to do a systematic review. So that's part of it, encouraging these multidisciplinary teams, but also really to promote that role of the librarian and information specialist in enhancing the quality, and really also being there as a guide for people who are trying to do systematic reviews, because we really have to be familiar with the entire process in order to be able to help people achieve these high quality reviews appropriately. So I think a lot of that has to do with the fact that there aren't very many of us around. And so we can certainly come up with methods of doing faster systematic reviews, as I know my esteemed opponent has been very involved in doing. And others as well have been really trying to focus on ways to speed up the process of doing a systematic review to enable librarians and information specialists to do more of them. But librarians also have competing issues out there. So data management, just doing regular old literature searches to inform clinical care. There's all sorts of other things that we need to do as well. And so I think we need to increase the number of librarians, and we need to really make sure that our institutions are not closing libraries, because we are professionals that really add to the research and can really help to influence clinical decision-making down the road.
Yes, thank you. I think that's excellent. I think we should encourage more medical librarians to be involved more earlier in the process. I think that's critical, because late in the process, very often the researcher are not open to critique on their search. So should we not offer the help of the medical librarians instead of what you now suggest to offer it as a service to editors? Should you not offer the help of the medical librarians to the authors who do not have access to medical librarians? Would that be a solution?
That is a solution, but as I said, I think that just the limited number of librarians and information specialists really does impact our ability to help as many people as we would wish. We are seeing systematic reviews just come from every quarter. A big concern is systematic reviews that are being done by students as a 6-week research project, and we can't be involved in all of those. We can try, but when you're talking about a lot of student projects in particular, for example, we might not even know that they're there. A lot of that is on us because we need to be able to promote our services better, to make sure that people understand what our skills are, what we really bring to this process. But we're just a finite resource as well. And so I think that adds some challenges.
And how do you see your role as a library director in that case? Because you say there's limited manpower. It's one of the problems indeed. I assume you employ a few information specialists in your institute. Do you give them time to do peer review of other during their work hours, or is it more like the off-duty information specialist who is a stakeholder in this case, or is it the on-duty information specialist that is a stakeholder in your case?
My institution has librarians who are faculty. So we really are expected to do peer review as a portion of our job. And also we really do try and make sure that we're working with our institution to meet the greatest needs there. So our research, education, and clinical information services team actually all is in the process of becoming specialized in systematic reviews. So they're going through the whole MLA systematic review specialization. I think almost all of them have achieved level 1, and now they're working on level 2. And really the idea there is to make sure that we have this cohort of people that can help each other. So we also have community of practice sessions for them so that they can bounce ideas off of one another. We are doing peer review of each other's searches, especially because we have a lot of new faculty who really need that extra guidance and support. So as a library director, I'm really always trying to make sure that we're building skills and really encouraging professional development.
I would advise them to stop doing peer reviews from each other's searches, because then we're working with 2 information specialists on one review. If your hours are limited, then I would say make sure that every search is at least seen by at least 1 information specialist, and only then maybe start doing each other's peer reviewing each other's searches.
I think that's great, except for if you're brand new.
Corrector.
There is no time for another question because time is running short. I'm sorry to say this. We're just on time now. And we move to the next opponent, which is Dr. van Amersfoort. Dr. van Amersfoort is an assistant professor in the Department of Occupational Epidemiology at Maastricht University, and I also give him the opportunity to discuss with you. Dr. van Amersfoort.
Dear Ms. Candidate, I would also really like to join the compliments made to you and your promotion team made by my previous opponents. But of course, there's also room for questions, and I want to focus my questions on the timeline of the different studies and the generalizability of your findings. As you also briefly discuss in your chapter 8, and more specifically in paragraph 8.4. You stated in this paragraph that you did not examine how the passage of time may have impacted transparency, reproducibility, and the quality of search strategies. And of course, I tend to agree with your observation that it's difficult to assess the change in scientific publishing and their impact over time. This might be a too easy way out. From my own observations, I can say that much has changed over the last 10 years in the field of scientific publishing, with also an increased attention and use of reporting guidelines over the last few years. So my assumption is that the increased familiarity with and more common use of reporting guidelines in general, and for systematic reviews in particular, has empowered dedicated researchers and thus reviewers in reviewing the search strategies reported in journals, and thus might have led to a null finding with regards to the added value of librarians, information specialists, as methodological peer reviewers in your intervention study, as reported in chapter 7, with recent collected data. So first question is, do you agree with my assumption? And then related to this question, do you think that the results of your first two studies with data gathered in 2012 and 2013 respectively would have yielded the same results if repeated now? And if not, can you elaborate on the changes you expect and possible implications?
Esteemed opponent, thank you so much for your kind words, and thank you for these great thoughtful questions as well. I would say that I do agree that there has been a proliferation of reporting guidelines, that there is more familiarity with them, but I think that what we are actually seeing is a lot of rote copying of using reporting guidelines. So people see that it is written in someone else's study, that they have, and they usually almost always say, conducted the study according to the PRISMA guidelines in the case of systematic reviews, which is not accurate because PRISMA is a reporting guideline and not a conduct guideline. So it's not clear that people have a clear or deep understanding of what a reporting guideline is generally, though I think that there's a lot of name recognition. And of course, a lot of journals are requiring at least the submission of a checklist so that people can theoretically assess it who are peer reviewers. I'm not sure that reporting guidelines have done a lot to improve the reporting quality, specifically of the searches, in particular because the reporting guidelines prior to PRISMA-S were really pretty generic in how they told you to document and to report searches, especially for the pieces that weren't directly related to databases. So I think it was hard for people to understand how to report completely from those guidelines. I am hopeful, especially that as more librarians and information specialists use PRISMA-S, that there'll be more of a standard on how to report some of these things and hopefully be better going forward. In terms of your second question, if we were to repeat the studies from 2012 and 2013, I do think we would get different results. And I will say that this is actually a question I've been thinking about as well, because I think when we did the study, especially the study looking at the 5 general and internal medicine journals, so it was, JAMA, New England Journal of Medicine, BMJ, and a few others, we were probably seeing librarians who were co-authors in particular on those studies that had years and years of experience with systematic reviews. And now we are seeing a wider proliferation of systematic reviews generally, it's just exploded. And we are seeing fewer people who have that deep kind of 15-year doing this expertise. And so we're just seeing a range, I think, of people who are in the early stages of their careers trying to do these expert searches, as well as people who are more late stage. Whereas I think earlier we were seeing a lot of the people who had been involved in the Cochrane collaboration, for example, for many, many years. So I think if we were going to be redoing the study, I still think that we would probably find that librarian co-authors, for example, are still associated with higher quality, both of methodology as well as reporting. But I think that we would see perhaps not quite as strong an effect as we did in that first study. The one on cardiology, surgery, and pediatrics, I would actually really like to redo at some point, because cardiology had 0 articles in the time period that we looked at that had a librarian as a co-author or even involved. And I would like to know personally whether or not that has changed subsequent to 2012. I have high hopes, and so maybe that would actually help to improve the quality of some of those cardiology systematic reviews.
So you expect the impact of involving a librarian to be less now than it has been. And because in my observation, it's also that the databases and the indexing really improved the last year. So maybe the impact in that respect also from involving a librarian might be less in that case. So is that something you also expect, or is it?
I am cautiously optimistic that the librarian co-author benefit will stand the test of time, but maybe to a slightly lesser degree. I do not think that databases are better or improved. So I will have to respectfully disagree with my esteemed opponent on that one. I think that actually a lot of what they've done is obfuscate how the process works. And so it's actually harder to do a reproducible search in some of those databases now. And I think that because our focus now is on making it easy and simple and like Google, that a lot of some of the specialized kinds of searching that really need to be done to get a highly sensitive search are actually harder to do and require more expertise than they used to. So we are seeing things come out, for example, that say, oh, you can just use Google Scholar and do a systematic review because everything's in Google Scholar. Well, you still need to know how to find it.
Yeah. Thank you for your answer. I'm looking for the pro-rector. Is there time for some more questions, or should we go to the next candidate?
We have only 1 minute, and I think to make the question and answer the question takes more than 1 minute. So I would prefer that we continue to the last opponent, and we go to Professor Prins. And Professor Prins was not a member of your assessment committee, but we are pleased that he could step in the late stage, and I would like to give him the word. Professor Prins.
I hope you're muted.
You have to unmute. You're not unmuted. Yes, you're not.
Yeah, no, I'm unmuted. Yeah. I have one question. I did a lot of systematic reviews with a lot of colleagues, and my own question is, when you do a systematic research and you search a lot of articles, usually you get 1,000, and then the only relevant are only 10 or so. Why?
Highly esteemed opponent, thank you for your question. The reason why is that in order to get as many relevant materials as possible, you need to do a really sensitive search. And a sensitive search is by its nature going to pick up a lot of things that are not relevant.
Mm-hmm.
And I recently actually did a search last week, actually, where I received some of the same questions. I was trying to do a sensitive search as possible to try and pick up all of the publications at my institution that were on substance abuse. And the person I was working with who had requested the search had questions about why some of these irrelevant resources were showing up in that list. And the answer is because if I constructed a search where they didn't show up, then you would be missing 20 or 30 of the actually relevant articles, because that's how you really have to construct a search. So it does make it difficult, but really the idea is to make sure that you are finding all of the evidence to answer a question and not just the stuff that's really easy.
Okay, so but in some of my recent projects, I had students finding 1,000 relevant articles, and in the end, only 10 were really relevant. And do you have a? I think the sensitivity, so you should find it and not miss it. But is there anything in your mind that could be helpful to really make it specific? So you do not find the things that are everywhere, but you do find the things that are relevant.
I think that there's a lot of different ways that you can try and balance the sensitivity and specificity of a specific search. And it really depends on what that search is and how you need to answer that question to do it. There are some topics that are just really difficult to try to answer. And with a search, they're just too nebulous. They have too many different ways of stating the same kinds of information. They may use completely disparate terms in order to describe what is essentially the same thing. And so some topics, I don't think you're ever going to get around it. On average, systematic reviews have been shown to have between 1% and 4% sensitivity for their searches. So you would expect that you would find 10 articles, but hopefully in a set of 1,000, it would be more like 100 articles in order to get at that 1% sensitivity. So there are probably some specific things that could be done with that search. I would say that usually what we try to do is a combination of searching of thesaurus terms. So for example, using medical subject headings or M-tree terms, as well as to use keywords, but to use keywords in a way that's sparing. And I think that what we have seen, especially in a lot of systematic reviews recently, is that people are relying specifically on keywords, and they're using a database like PubMed, for example, where there's actually stuff going on behind the scenes. And so if you aren't specifying what fields that you need to search in, you are probably going to get a lot of results that aren't actually relevant for what you do. So expert searchers will tend to instead pick the specific fields that they want to search so that they can try and get rid of some of that extra irrelevant material.
Mm-hmm. Yeah, but
what
I would say,
Professor Prince, you mentioned I have only one question, and now you're going to start your third question, and that's why I would like to give the opportunity to Professor Boutron, who indicated to me that she has an additional question before we have to close. So I'd like to give her the word.
Okay, no problem.
Can you please mute?
Thank you.
Thank you. Professor Boutron.
Thank you very much, Prof. Dear candidate, I would like just to go back to the PRISMA guidelines that you developed, the extension that you developed, because one of the major issues of this extension is the implementations. A lot of guidelines are being published, a lot of extensions are being published. Perhaps some people say there's too much extensions, which make it impossible for people to use it. How do you foresee the implementation of your guidelines extensions?
Highly esteemed opponent, thank you for that question. And I think I see it in a multifaceted way. So one is, of course, we've been trying to educate librarians and information specialists and also systematic reviewers about its existence. Second, it really has been incorporated into PRISMA 2020 as well. So looking at PRISMA 2020, you can see some of the components there. So hopefully a little bit has been collated, but also we are working with the Prismatic project, which is a project that is designed to bring together PRISMA and all of its extensions into basically one guideline so that you can choose based on what your systematic review is focusing on, which guidelines are going to be the most appropriate. And so our team, the executive team for PRISMA S, has been working with that project to really try and make sure that PRISMA S is fully integrated there. And though I think we've seen some challenges in the past with the use of web-based tools in order to influence reporting, I do think that there's at least potential that then it might become even more known than it is currently, and hopefully be there as a guide for those people who really do want to report things clearly and transparently.
Thank you very much. I leave it on to the Prorector.
Okay, then I would take the opportunity. Sorry, then I take the opportunity and I give another word to Dr. Bramer because he wasn't finished in the beginning. If he wants, short question, please.
I'd like to continue on You describe as in your role as library director, you have had some opportunities to improve the quality of your of the systematic reviews of your institute. Do you have an idea how well you have done? What have you succeeded in recently in your current position or previous position?
Esteemed opponent, I thank you for your question, and I have not officially studied it. I find that in my role as library director and also in my role as...
Thank you very much. Ms. Candidate, you are allowed to finish your answer, but you also have the possibility to say, I stop and I'll leave it with it is. It's your choice.
I'll stop and leave it as it is.
You like to stop. Okay, that's a good point too. Very well, very good. So, dear Ms. Candidate, dear Ms. Rethlefsen, the time appointed for defending your thesis has now officially passed. The degree committee will now withdraw. We stay here, you will be removed some way, and we're going to discuss not so much the quality of your thesis that has already been approved by the assessment committee, but we're going to discuss the way you have defended your thesis this afternoon, or in your case, I suppose, this morning. And I request that you wait till we are back and they will bring us back in some kind of a medium, I don't know, but just wait here about 10 to 12 minutes and we'll be back. Thank you. So technical team, bring us to an Very good. I think we are almost complete, except Professor Prince. And he's coming in. No, not yet. We are waiting, Miss Candidate, we are waiting for one opponent, Professor Prince. And I'm sure I don't hope that we lost him. Technical team, is there a problem?
Sorry, Mr. Prorector, I'm checking it right now. It seems like Professor Prince has left the session. I'm trying to contact him, and if I'm able to contact him, I will let him back in.
Okay, because I will continue now, okay? Thank you very much. Dear Miss Candidate, dear Miss Rethlefsen, the degree committee here present, online, of course, has assessed not so much the quality of your thesis, that was approved, but we really discussed intense the way you have defended your thesis this afternoon or for you this morning. And in view of its positive verdict and taking into account your previous qualifications, the degree committee here has decided to grant you officially the degree of doctor. Professor Segers, your first promoter, is authorized to confer upon you this academic distinction in accordance with Dutch university customs, and therefore I invite your supervisor now to take the floor, or we say, I give him the word. Professor Segers.
Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
I do.
By the authority vested in us by law and in conformity with the decision of the committee here present online, I hereby confer upon you, Melissa Lyle Rethlefsen, the degree of doctor, and I grant you all rights attached by custom and law. As evidence of this, you will soon receive the degree certificate signed by the rector, the secretary, and the supervisor affixed with the official seal of the university now shown by the beadle.
Thank you.
And I now give the word to Dr. Sarah Schruter.
Dear Dr. Rethlefsen, dear Melissa, it's a great honour for me to be the first person to congratulate you on obtaining your PhD. It's a marvellous achievement and an important milestone to acknowledge. Congratulations as well to your undoubtedly proud family who have supported and encouraged you every step of the way. I know it feels like a long journey to you, PhDs always do, but you actually got there very smoothly and really deserve the praise that you've received from everyone today. You're our first student on the joint BMJ Maastricht University PhD programme on the responsible conduct of publishing scientific research, which we set up back in 2020. We truly could not have asked for a better first student. We didn't know who would be interested in our programme. We're absolutely delighted to read your application, and a little surprised that word of our programme had reached medical librarians. As soon as we met you, we were in complete agreement that you were the perfect fit for the programme. Although, of course, with the exception of meeting Lex at the World Conference of Research Integrity, due to the pandemic, we've never actually met you in person, and your PhD has been entirely virtual. Throughout your journey, you've consistently demonstrated remarkable motivation, a commendable ability to transform our feedback into meaningful action, and an unwavering commitment. Your clear and focused vision has been matched by your enthusiasm and your dedication to your work. Always prepared and equipped with a sense of humour that brightens our meetings, you have exemplified what it means to be a diligent and inspiring scholar. You've also taught us a lot, and we are grateful for this. Some of the highlights must include, firstly, attracting Professors David Mower and Jamie Kirkham to collaborate on some of your studies. At times, it must have felt rather supervisor heavy, with all of us keen to share our sometimes divergent opinions, but you managed us well. Secondly, easily getting all of your articles published in respected high-impact journals. And thirdly, I'd say the usefulness of your articles. Your Prisma S paper, published in Jan 21, has already been cited well over 1,500 times. That being, it is now classed as a highly cited paper in Web of Science, placing it in the top 1% of the academic field of clinical medicine. That is a great achievement. Your journey does not end here. In fact, it's just beginning. You've already demonstrated exceptional skills as a researcher, and it's clear you will be busier than ever, with numerous requests for collaboration coming your way from those encountering your impressive work. And of course from me, although you know that as we've already started collaborating on a number of projects. It's evident that the skills you have honed so successfully during your PhD will continue to be put to excellent use. We have absolute confidence in your abilities and look forward with great enthusiasm to celebrating all your future accomplishments. It's with sadness that we can't be with you today to carry on with the celebrations, but Lex, Maurice and I are very much looking forward to meeting you in person in Chicago at the conference, the Peer Review Congress, to help celebrate with a congratulatory dinner then. Melissa, thank you on behalf of both Lex and Maurice as well. It's been an absolute pleasure and an honour to have been your PhD supervisor. Thank you.
Thank
Back
you.
to the rector.
Well, first of all, we go to applaud. Yes. And then secondly, I would like to say also a few words to the new doctor. So Dr. Rethlefsen, I think it sounds good and you have deserved it. We came to a unanimous positive decision, and I would like to mention this, that you did a great job today to really defend your thesis with all your answers. Also on behalf of Maastricht University, of our board of directors, I would like to congratulate you with this academic distinction. And for the Netherlands, it is the highest academic distinction which you can reach. So that you are now a full doctor and you can call yourself a doctor. And in my congratulations, of course, I also include your promotion team, because they have guided you, and I understand now, completely virtual, guided you over the last years to bring you to this point here. And that's really a very nice achievement. In my congratulations, of course, there will be your family who are here, maybe looking in your live stream. They're looking from somewhere. I have no idea where you are situated. I noticed you are in your booklet, you are from Minneapolis. So I'm not sure if you're actually now in Minneapolis. May I ask that? No? Where are you?
No, New Mexico, Albuquerque, New Mexico.
Oh, that's the same time. That's the 8 hours time differences anyway.
Yes.
That's very good. And that makes sense. Very good. I will also thank the members of the members of the Corona, the 5 members here. There were some tough questions, and it takes time to take questions. It takes time. They have 9 minutes to ask you questions, but it takes more than 9 minutes to prepare these questions. And for that, I would like to thank them, and also thank them that they joined today for this celebration. But fortunately, it would have been now time to do some celebration, to have a drink. In the Netherlands, it's just not coffee. You can have a glass of wine and you can have a glass of beer, but unfortunately it's all virtual and we just can think about it. Yes, and we can't use it. But I would like to say, enjoy the day. It's your day. It's the day where you shine. It's the day where you have where you did officially your PhD, and you really should like to remember it. We will send you our official bill later. It will be signed by me and also by the Abactis, the secretary. And I hope you enjoyed the opportunity, and I wish you a lot of success in your further career as director of a major library in Albuquerque in New Mexico. Thank you.